Hello, everyone. So this patient presented with acute abdominal pain and concern for small bowel obstruction. So a CT scan was performed, and the CT scan shows these are the axial contrast enhanced CT images of the abdomen, and these are the coronal contrast enhanced CT images of the abdomen. And as we can see here, there is herniation of contents here in the right lower chest, and this is the diaphragmatic lining, and there is a defect in the diaphragm here, and with the localizer line here you can see it is the defect is interiorly and to the right of the midline, and you can also see that better here on the SAG images. That's the defect in the diaphragm with extension of content superiorly. So this is consistent with a foramen of Morgagni, and that is basically a sternocostal triangle space from which, if it is not filled up, there can be a bigger defect and there can be extension of contents. Usually it's omental fat, but sometimes there is extension of bowel loops that can happen through this defect. So as you can see here, we can see that's the diaphragmatic lining that we can see, and there is this defect and there is extension of the omentum with small bowel loops with contrast in them, and these small bowel loops are dilated. What we also see is some of the large bowel loops have also extended within the hernia defect. So on the axial images, we can see it much better. So this is the dilated loop of small bowel containing air fluid level, containing contrast. And if we follow it down to the level of the hernia, we can see this loop of bowel is decompressed. And at the same time, there's another loop of bowel right here that goes down here and is decompressed right next to it. So this is a closed loop obstruction with transition point at the level of herniation at the level of foramen of Morgagni. And this is obstructed loop of small bowel within the hernia sac. There is interloop fluid, and there is this mesenteric edema. And as we can see here, the and follow the mesenteric vessels along the mesentery, we can see that as soon as the mesentery enters into the hernia sac, there is vascular engorgement and edema of the mesentery within the hernia sac. But if we trace it down here in the abdominal cavity, there is no edema of the mesentery. So that also is secondary to the local mass effect and constriction at the hernia site that has led to the mesenteric edema here. There is some reactive edema all around. So this patient is these findings are consistent with foramen of Morgagni hernia containing obstructed loops of small bowel causing closed loop obstruction. Additionally, we see there is these large loops of large bowel loops, and they are not dilated and they do not demonstrate any evidence of obstruction. Thank you.